Good afternoon, everyone. This is Dr. Astra Webb from North American Management. We wanted to begin our webinar presentation for today. North American Management is pleased to present today's topic, Debunking the Myths of Older Adult Falls. And we are really honored to have the National Council on Aging as our guest presenters for today's webinar. This webinar training is designed to provide you as health center personnel about falls prevention for seniors living in public housing. The webinar will discuss and debunk the 10 common myths about older adult falls, and you as personnel will learn why everyone has a role to play in preventing falls, what evidence-based programs are available, and how to link your clients in the community, how to promote awareness and prevention during Falls Prevention Awareness Day and all year round, and how to join your state and local falls-free coalitions and get involved. Well, right now I would like to introduce our presenter, Ms. Emily Watson. Emily Watson is a Senior Program Associate in the National Council on Aging's Center for Healthy Aging. There she supports healthy aging initiatives, sustainability, and policy opportunities within falls prevention and behavioral health. She provides technical assistance to grantees and state coalitions and supports the Center for Healthy Aging's work disseminating evidence-based programs in communities across the country. Her work focuses on the Center's Falls-Free initiative and supports NCOA's behavioral health work. Emily received her BS from Wake Forest University and her Master's in Public Health in Health Policy and Management from the Mailman School of Public Health at Columbia University. So I'd like to welcome Ms. Emily Watson now, who will be the key speaker for today's presentation. Ms. Watson?
Great. Thank you so much, Astral and Kevin, for putting this together, and for everyone on the call for having me. We are very excited. NCOA is going to have a couple opportunities to work with the National Center for Health and Public Housing to present on topics that we believe are of interest to all of us. Aging and the population change that's going on with the baby boomers aging at a rate of 10,000 a day of people turning 65. The healthy aging issues and costly events like a injurious fall are things we really can't ignore anymore. And I think this is a great opportunity for us to start a conversation. I'm hoping to go about 35 or 40 minutes and leave time for questions. So please don't be afraid to speak up, and I will look forward to talking and answering some of your questions at the end. So first, a little bit about NCOA. And this is my contact information, and I can repeat this at the end as well. NCOA is a nonprofit service and advocacy organization, and we're based in Washington, D.C. Our mission is to improve the lives of millions of older adults, especially those who are vulnerable and disadvantaged. And NCOA works primarily in two areas, in health and in economic security. I am in the health impact area in the Center for Healthy Aging, as Ashel mentioned, and those are the two big focuses of our work. We accomplish our mission through four strategies: collaborative leadership. We bring together nonprofit, business, and government to address key challenges in an aging society. Innovation. We help develop and bring to scale innovative services and evidence-based interventions that improve health and financial well-being of older adults. Our two other strategies are advocacy. We're a leading national voice and advocate for vulnerable and disadvantaged older adults and organizations that assist them. And services. We work with thousands of organizations across the country to help seniors find jobs and benefits, improve their health, and live independently. Our social impact goal for 2020 is to improve the health of 4 million older adults with multiple chronic conditions through participation in evidence-based programs that we know to be cost-effective. Our other goal is to make self-care and self-management an integral part of U.S. healthcare for people with multiple chronic conditions, which is also in line with much of the Obama administration's focus and the multiple chronic condition framework. So Astral mentioned our objectives. First, I'm going to talk a little bit about the problem and give you a teaser onto what NCOA and 40 states around the country are working towards in the Falls Free Initiative and Falls Prevention Awareness Day. And then we're going to jump into the content about the 10 common myths about older adult falls, which is a little bit more of a fun way to think about the issue and to hopefully debunk some common misconceptions about older adult falling and fall prevention. The overarching objective is to have a good understanding of the issue and key strategies to prevent falls and how you as a health center personnel can take steps to promote independence and safety and empower older adults to take steps to keep them safe. So I'll come back to this, but as a primer on what I do and what the work we do here at NCOA, we lead the Falls Free Initiative. It's a coalition of 70 national organizations and 40 states working collaboratively to reduce falls among older adults. And we bring healthcare, public health, and aging together. It's been going on for about 6 or 7 years, and in 2006, formally became the full initiative with states and national organizations working together when states approached NCOA and said, hey, we'd like to be a part of it. And that, to us, makes perfect sense. These are the people that are on the ground and doing the work. So we have state coalitions that have leads in public health, in the state public health departments, and the state aging departments, who lead state coalitions working on this issue. And in many states, there's local coalitions on fall prevention. And I'll talk more about the coalitions at the end of the presentation, but just wanted to give everyone a context of the role NCOA plays. And I'll come back to this as well. This is Fall Prevention Awareness Day, the first day of fall every year. So this year, first day of fall is September 22nd. And I'll come back to Fall Prevention Awareness Day at the end. So, some things about falls. Falls are common. They are predictable. But the good news is they're largely preventable. And the other take-home and takeaway is that everyone has a role to play and can make a difference within their sphere of influence. 10 common myths about older adult falls. One thing to note is that most falls can be prevented, and you have the power to reduce your client's risk and also your own risk. Myth 1, falling happens to other people, not to me. The reality is that 1 in 3 older adults fall every year, that's a lot. About 12 million persons aged 65 or older will fall each year. And those who fall will become, having had a fall makes you 2 to 3 times more likely to fall again in the future. So it's a very common and more common than people think, the occurrence of falls. Give you a perspective of what that means, the 12 million that fall. 2.3 million are admitted to emergency rooms for fall-related injuries, and over 650,000 are hospitalized as a result of a fall. This only shows us part of the picture, though. Of the 12 million, we have no way to capture presently the number of people who go to primary care, go to their doctors, go anywhere else besides the emergency room to seek care. So these are large numbers in and of themselves, but we also know that they're not the whole story. Related to those ER visits and hospitalizations, the direct medical costs for fatal and non-fatal falls is over $28 billion. That's almost $30 billion per year that just accounts for the direct medical costs. The figure with caregiving and hours lost at work is much higher. It's about $60 billion. So it's a very costly and common problem. Now, to myth 2, a lot of people think that falling is a normal part of getting older. This is incorrect. Falling is not a normal part of aging. But there are steps that we're going to talk about today that you can encourage your clients and your patients to engage in to improve their independence and their physical health and make their environment safer. So steps an individual can take are strength and balance exercises, managed medications, vision checks, and having your living environment modified with such things such as consistent lighting in all rooms, or removing clutter, or putting commonly used plates and things in shelves at the most easily accessible level. Not having the plate you use every day way up high, so you are more likely to be off balance. So these are steps, and the important part is that falling is not a normal part of aging. The third myth we'll be discussing is, if I limit my activity, I won't fall. Now, this is a common misconception among older adults, and it's completely untrue. By limiting activity, people can lose strength and range of motion, and performing physical activities and staying active will help older adults and all of us stay active and independent and increase our ability, our strength, and flexibility. There's also the positive impact of social activities. We know that depression is a risk factor for falls, so there's positive. The reverse is true. So positive interactions and socializing is also good for overall health. So performing physical activities and staying active is a very important part of preventing falls. To the next myth: as long as I stay at home, I can avoid falling. The truth is, over half of all falls take place in the home. There are simple but serious hazards, such as a few that I mentioned: clutter, throw rugs, poor lighting, and they can then be easy fixes, but you need to be aware of them and make your older adult clients aware of these things. Grab bars in the bathroom or a second handrail on stairs are two other examples, and the list at the end will include the CDC brochures and information on home safety, and their overall brochure on older adult falls, both of which are excellent resources and available at no cost from CDC's Injury Center. So I would encourage those of you who are involved in ordering materials at the center. These are a great resource. to either start a conversation or to just send home with the client after a visit. Myth 5, muscle strength and flexibility cannot be regained. The truth is, we do lose some muscle as we age, and but the good news is that exercise can restore some level of strength and flexibility, and it's never too late to start an exercise program. That's one of the best things about the human body is that, if you, doesn't matter when you quit smoking or start an exercise program, it's never too late to start to receive positive benefits from engaging in health behaviors. So even if you've been a couch potato your whole life, becoming active now will benefit you in many ways, including protection from falls. Myth 6, taking medication doesn't increase my risk of falling. The reality is, taking any medication may increase your risk of falling, and definitely taking multiple medications can even further compound that risk. Be careful when starting a new medication. Make sure you talk to your health provider, and as a provider, make sure you talk to your clients about potential side effects or interactions with medications. For caregivers, it's important to know what medications they're taking and to have a doctor or pharmacist review all meds. And caregiving is an important piece in this discussion. It's also best to use one pharmacy for continuity and to make it easier to have medications reviewed. Medications affect people in many different ways and can sometimes make people dizzy or sleepy, so very, very important that medications are coordinated by a health provider. This slide highlights the easy way it is for medications to pile and pile and pile on. So it's just a funny image of interactions, and the end says the fourth protects the spleen but has been known to eat away the prostate. The fifth, so you can see that this is an exaggerated idea of what interactions can be. But the next slide is myth 7. I don't need to get my vision checked every year. Vision is another key factor. Another key risk factor for falls. People with visual problems are more than twice as likely to fall as those without visual impairment. For those with low vision, there are programs and assistive devices that can help. Asking a optometrist for a referral is helpful, and it's really important to encourage older adults to have annual eye checks and to update their eyeglasses. On to myth 8. Using a walker or cane will make me more dependent. So this is, I think, relates a little bit to a older adult's desire to be independent and on their own. And it's about a balance between that and the value in assistive devices. Walking aids are important in helping many older adults maintain or improve mobility. However, these devices can be used incorrectly, which can make them an even greater risk for falls. So if an older adult that you are seeing in your center presents and has a assistive device, then it's important to help make sure that they are properly using the device and ideally have a physical therapist fit the walker or cane to the person and instruct them on safe use. Myth 9. I don't need to talk to family members or my healthcare provider if I'm concerned about my risk of falling. I don't want to alarm them, and I want to keep my independence. It's a understandable concern of an older adult, but it's important to frame the issue that fall prevention is definitely a team effort. Bringing up issues with their doctor, family member, or anyone else that's in a position to help is a very important part of creating a culture where we can talk about fall prevention and really make a difference. And in the strategies that I'll talk about next, there really are ways and steps to take to reduce the risk of a fall. People, providers and family members and others want to help the older adult maintain their mobility and reduce their risk of falling. So it's important to talk about it in that way, that it's not about taking away the independence of the older adult, but about working together to maximize their independence and their safety. For our last myth, I don't need to talk to my parent, spouse, or other older adult if I'm concerned about their risk of falling. So this is from the perspective of a child or other family member. And caregivers and and family members can be afraid of hurting their loved one's feelings or feeling like it's none of their business. But this is really another one of those important myths that we need to debunk. Letting an older adult know about your concern and offer support will help them maintain the highest degree of independence possible. And like the steps we just talked about, a vision exam, setting up a vision exam, removing hazards in the home, and also finding a fall prevention program in the community are all things that you as a provider can talk to and encourage caregivers and your older adult clients to do and to take those steps. Caregiving is a really important issue. 65 million Americans, which is about almost 30% of the entire U.S. population, provide care to a chronically ill, disabled, or aged family member every year. So that's a huge burden that is not compensated for. An average caregiver spends 20 hours per week providing care, and it equates to $375 billion provided in quote-unquote free care every year. So the caregivers are a very important part of this conversation. So if it comes up in conversation that a younger adult client mentions their concern about their parent, this is definitely another one of those teachable moments and another place to intervene and encourage everyone to take steps. Okay. Now that we've talked about the myths, we need to talk about what works. Clinical assessments, these include balance screenings and gait screenings by physical therapists and other providers to assess what the physical limitations and mobility of older adults may be. So that's an important piece. Engaging in physical activities and exercise, particularly exercise that has strength and balance components, is a really important piece. And there's evidence-based programs that CDC and the U.S. Administration on Aging, a agency within HHS, promote, and I'll talk about a couple of those. These are community-based programs, so it would be a great opportunity for those in the health centers to refer to learn about what's going on, what programs are available in your community, and to link older adults to these programs. Improving home safety is something we talked about. Vision, lighting levels, a second handrail on the stairs, grab bars, easily accessible items, clear pathways. These are all very important in having a safe home environment. The fourth strategy is managing medications, as we discussed, and really making sure that you're working with a provider to have an older adult's medications reviewed and managed. The last risk factor and strategy is maximizing vision. So it's really important to have the annual eye exam, as I mentioned, and to keep your eyeglasses updated based on changing vision needs, and to regularly communicate with a provider about that. So this slide gives a visual representation of how we will make a real difference, and it's all about collaboration. Everyone's involved, from community colleges and schools to city planners. Urban development and city planning is a very important piece in fall prevention as well, with building ramps and sidewalks and to fill in cracks in the road and other obstacles and potential fall prevention obstacles. And then another thing I just wanted to pull out was the role of EMS. Many communities around the country are seeing a large rise in their first responders and fire department and EMS going out for an older adult fall. So a number of them around the country have come up with pretty innovative pilots and demonstrations looking at how EMS and first responders can use that interaction as a teachable moment. One model that I know of and we're working with is for those visits that don't involve a transport to the hospital, and the injury isn't significant enough to be transported. The EMS and first responder teams have a protocol and share information and help the individual take steps to link to the evidence-based programs in the community and to improve home safety and all of the other risk factors we talked about. So that's a really interesting model. Home-based care and hospitals and certainly health centers, primary care, are all major players in fall prevention. And we always say everyone has a role to play. As an older adult, the child of an older adult, as a grandchild of an older adult, as a provider, as someone who sees older adults in the community, like a librarian or a restaurant employee. There's leverage points everywhere, and we believe that local, state, and national collaboration will bring broad awareness of the issue, specifically that falls are not an inevitable part of aging. It'll bring training and education to providers. It'll also bring evidence-based programs, services, and resources to older adults, targeting prevention through risk reduction. And this is an important piece because the programs must be accessible to those most at risk, really make a difference. The fourth goal is to bring seamless transitions from community programs to community programs from healthcare and vice versa. So this is a really important piece, I think, for this audience. Here's another demonstration of how wide the variety is of people who have a stake in this. And the quote we have here is, "It takes a village of stakeholders working together to prevent falls and reduce falls risk, a task that no one stakeholder can accomplish alone," which is a very important point. And key stakeholders include older adults, caregivers, both family and professional caregivers, healthcare, including health centers and policymakers. When it doesn't look like this, one of the pictures came out. These are two accompanying documents on CDC, and the one on the left, which is, at least in my view right now, is looking like a white box, but in my slide set looks like the cover. But on the left, there should be the CDC compendium of effective fall interventions. And this compendium was updated last year, and it includes 22 interventions. And the Injury Center at CDC is promoting dissemination in 3 pilot states with 3 of the 22 programs in the compendium. And those programs are Tai Chi, Moving for Better Balance, Stepping On, and Otago. I can talk a little bit more about that, or if you have questions, we can talk about that after. And the document on the right is a report by CDC that goes with the compendium about how to develop fall prevention programs in the community. So how to implement the programs that are featured in the sister document. The Administration on Aging also promotes fall management programs. Like CDC, they promote Tai Chi, Moving for Better Balance, and Stepping On, and 2 additional programs, Step by Step and A Matter of Balance. Matter of Balance is in 36 states across the country, and it's very well received. It is it focuses on reducing the fear of falling, which is another risk factor for falls. So there's a lot of really good primers on each of these on the NCOA website, on ncoa.org, but I can give you a brief overview of some of the programs that are listed here. Tai Chi, Moving for Better Balance, is a time-limited, tailored and structured Tai Chi program that has been found effective, and it's based out of Oregon with Fujian Lee. Stepping On is originally from Australia, and it combines classroom and exercise, and is also one of the programs being disseminated by Stepping On. Otago is a provider-led intervention, and you can get anyone more information on that program if they're interested. And Matter of Balance is promoted through the Partnership for Healthy Aging in Maine. And like I said, it's been widely disseminated, and it's a popular program that really focuses on reducing people's fear of falling and their apprehensions, and focuses on empowering older adults. So this is the map that I put up earlier. I think that what we hope would be a great outcome from this presentation is that those who are interested find out what's going on in your area, and you can do that by going on ncoa.org/falls map. And this is an interactive map that shows and gives profiles of the 40 states that have state coalitions. And it explains who the leads are, gives contact information, so you can reach out. And depending upon, some state coalitions have been developed and around for a while, so they're very, very well established. Some are newer. And if appropriate, they can tell you about regional coalitions and regional efforts. There's a pretty good chance that there's things going on in your community now, so it would be great to be able to link the older adults you serve with the community-based programs, and some organizations like Rebuilding Together will help with home modifications, and different people have sponsored with Lowe's and there's a lot and a wide variety being done by the state and local coalitions, and it's been really exciting to see. The next slide is about partnering with the aging community. So for those on the line that aren't as familiar with the aging network, this will just give a high-level overview. The Older Americans Act was passed in 1965 in response to a concern about lack of social supports in the community for older persons. And the Act created the Aging Network to provide these services and established the Administration on Aging as the federal agency strictly focused on older persons. The original legislation established authority for grants to states for community planning and social services, as well as research and development projects and personnel training in the field of aging. And although older individuals may receive services under many other federal programs, today the Older Americans Act is considered to be the major vehicle for the organization and the delivery of social and nutrition services to this group and caregiver. It authorizes a wide array of service programs through the national network, made up of 56 state units on aging, 629 area agencies on aging, and over 20,000 service providers. But also, the Older Americans Act also includes community service employment for low-income older Americans, training, research, and demonstration activities, field of aging, and the vulnerable elder rights protection activities. The most recent reauthorization was in 2006, and a set of FAQs about the Older Americans Act and other related sources of information are available at AOA.gov on the Administration on Aging's website. In the Aging Network today, I listed what the makeup is like. The community-based organizations serve as the bridge between clinical treatment and home. That's a really important piece for older adults. So I'm going to go back to one of the first slides about mention the Fall is Free Initiative and state coalitions. So I just wanted to touch a little bit deeper on Falls Prevention Awareness Day. It is a growing and exciting effort. Some states choose to do Falls Prevention Awareness Week, do Falls Prevention Awareness Month. Organized nationally, we coordinate a national day, and we've had, last year was the 4th annual Senate proclamation, and it's really been growing. So you can tell the interest and need is being seen in the community by the participation over the years. So the first year there was a national organization of this. There were 11 states who participated. The following year, in 2009, had 22 states. So we doubled, so that was pretty good. Following year, in 2010, 37 states participated. And last year, we had 43 states plus Puerto Rico and the District of Columbia. So that was really exciting. So as I think I mentioned, there's 40 state coalitions, so even more states participated in Falls Prevention Awareness Day. And there's a lot going on. People conduct all types of education and public awareness events, screenings, and clinical assessments, home modification demonstrations. Some states have advocacy agendas and activities, and a wide variety of other and new and exciting ways. And it's been really great to see states, particularly those who started and could do a very limited amount the first year. Their activities have really grown over the last 2 to 3, and in some cases 4 years. So there's really great things going on, and we reach millions of older adults through this each year. So it's a great day and a great time to convene around the issue in September. So the last slide, almost there. So this is CDC Resources that I mentioned throughout the conversation. The 2 brochures, Check for Safety, a home fall prevention checklist for older adults, and the others, the general fall prevention brochure, what you can do to prevent falls. And then the other 2 listed here are the compendium of interventions and the accompanying document, How to Develop Community-Based Programs. And both of those are available. The brochures are available. Order as many as you'd like on the CDC website here. There's also great information about falls and about cost data, and the whiskers, the database is a great resource if you want to find out what's going on in your state or your county. And then NCOA resources are easy URLs. So I encourage all of you to go on ncoa.org/fallsmap to find out and read about going on in your state and in your local area, as well as ncoa.org/FPAD, FPAD. That's the Falls Prevention Awareness Day webpage. So we'd love to have many of you that are interested be involved, and we've just started really planning this year and how we're going to make this year the biggest year ever. This is my contact information, and if there's any questions, I would be happy to take them, and I open it up, and I don't see any Q&As in my box, so Kevin or Astral, are there any questions that you can see?
Okay. Emily, first of all, thank you very, very much for this, your discussion. I think it was very enlightening, especially for the health center professionals who work with older adults in public housing. We do have 1 or 2 questions that I would give to you, but first I would like to let everyone know, if you still have a question, please type it in the Q&A box. And also, we have some post-survey questions on the right-hand side, so we would like to ask those of you on those webinars to please complete those survey questions to help us better ascertain what we can do to improve on this particular topic. However, I think there is a lot here. Emily, one of the questions that we have here, first of all, you discussed the fear for falling that a lot of seniors have if they're fallen before and they've broken a limb or, hit their head or so forth. We know this might be a barrier for some seniors. You mentioned that there is a Matter of Balance program that is used to address this issue. For the health professionals, is there any form of a curriculum that they can know to have with their health center staff to address this fearful following issue? Yeah, the possibility may be if they do have behavioral health professionals, is that an opportunity for them to address that issue if they want to do it on site?
Oh, that's an interesting thought, the behavioral health provider. The Matter of Balance program is the only program that is recognized by either AOA or CDC that focuses specifically on fear of falling, and with the main goal of the program to be reduction and alleviation of fear of falling. I don't know of any other programs or specifically a provider-focused program, but the Matter of Balance program certainly used to educate providers in different areas and used with, for example, Walmart employees and people that come into contact with older adults. it's certainly applicable for anyone, but I don't know of any program focused on training providers. But the Matter of Balance program would certainly be applicable to those who interact with older adults in the community.
Excellent. One of the other questions that we have is that are these programs, if let's say for the communities in which these programs do not currently exist, and the health center tries to adopt one of these programs or begin one on a more community-based level, are some of these programs Medicaid or Medicare reimbursable? For example, CMS recently recognized a couple of yoga programs for heart disease prevention. To your knowledge, are there any of these programs that might also be reimbursable for the health centers for falls prevention?
Oh, the million-dollar question. How do you pay for it? Great question. The Otago program is a program that a trained provider gives the program, and there's 5 home visits usually, and it's a ET delivered program. And the program has, to the best of my knowledge, been able to be. It's being pursued to have a Medicaid waiver reimbursement. I don't know if it's been successful. I do think that people involved in the effort have received positive indicators from the state Medicaid office, and there's the return on investment study has not been published yet that my colleague at NCOA, Lynn Beatty, worked on with CDC, but it does show a return on investment in several programs. So in that being published, there is efforts to get Medicaid waivers to cover these services. But whoever is interested in this question, it's a great question. You can email me at emily.watson@ncoa.org, and I can definitely find out the answer for that question and put you in touch with people that are working on that.
Great. And then the final question is, you had the individual risk assessment that the health centers can use. Is this the same as the home evaluation questions that you suggested that they can use?
Which home evaluation question?
Sorry, I think it's a home assessment question. I believe, Emily, at the end of your presentation, one of your latter slides, you spoke about there was questions that you can ask a senior about their home, a checklist. I'm sorry, the home checklist. Home prevention checklist. Can that be used as an individual risk assessment in the health center environment where they're evaluating if the seniors are at risk for falls?
Okay, so I see. I went back to that slide. Check for safety, a home fall prevention checklist for older adults. I believe that's the brochure you're referencing.
Yes.
It could definitely be used as part of an education and tool for an older adult to use. It is only about home safety, though, so it doesn't have any of the other, there's no physical assessment that is part of that checklist. There are, those are covered in the next bullet down, what you can do to prevent falls, as a primer on the issues, but neither of them are, for example, the timed up and go. That's one physical assessment. So they don't include that level of clinical guidance, but the second one, what you can do to prevent falls, discusses the types of interventions that measure gait and balance and flexibility. So does that answer the question?
Yes, I think that answers the question for this particular area. And I believe what we could probably do is we can follow up also to see if there are any clinical type individual assessments that our grantees can use. So please check back on our website, and we will be able to try and share some of that information. I do not see any other questions in the queue at this time. And again, Emily Watson, we want to thank you so much for this presentation. It was truly, truly enlightening. If you have any other questions, feel free to email Emily at emily.watson@ncoa.org. And then we do, just for the interest, I think we had a couple participants from the housing authorities. We really want to encourage you also to reach out to go to visit the NCOA website and see where there are located community-based programs that can help your residents who live in public housing, who are seniors, in conjunction with what your health center personnel can provide. So again, thank you everyone for joining us. And this webinar will be archived, and you will have the opportunity to play back the recording. Please visit our website at nchph.org and go to the webinars. So again, thank you everyone. Thank you Emily Watson and NCOA for this presentation, and visit our website for other upcoming webinars. Finally, we would like to mention that we will have similar workshops available at our national conference, which is scheduled from May 1st through the 3rd at the Westin Hotel in Alexandria, Virginia. Thank you.